Hello, welcome to Pickwick Physiotherapy. This is a few exercises that are aiming to help you relieve really acute low back pain. So they're all nice and gentle. Take it steady, listen to your body. You're aiming to get a little bit more movement and a little bit more freedom as you go along. But be cautious, but breathe. So we're going to start off with a nice gentle knee roll. So first of all, you have relaxed back into a position onto your back. You've drawn your shoulders down your back a little. Your head's rested onto the mat. And you just check that your bum is really cemented down onto the floor. And then gently taking both legs over and across to one side. And you may find initially you can move just a couple of inches and then coming back up and over to the other side. So it's almost a gentle rocking movement. Just taking it steady, and as you feel able, allow the movement to get bigger and bigger, but still keeping it slow and fluid, breathing out on the effort. Lovely. So we're starting to get a bigger movement. Now, we wouldn't recommend a particular number of exercises for this. We'd recommend you listen to your body, and when it starts to feel like it's freed up, then move on to the next exercise. The next one is a nice gentle single leg bend up towards your chest. So you're going to grip your leg and gently pull it in, and you'll feel a pull down the back of your bottom into the lower back. Just gently pull it towards you and then switching over. Remembering to breathe, breathing out as you're going into tightness. Lovely, and keep switching over. Some people prefer to take it into a position and hold it. That's absolutely fine. Or you can switch rhythmically if that feels better for you. That's great. So repeating those as before until you feel like that's freed up, and then you're going to move on to the next one. The next exercise is designed to start to try and activate your core muscles even though you're struggling with pain. So what you're first of all going to just check is where your headlights of your pelvis are. So just place your hands on there. You're aiming to try and keep your pelvis nice and level through this movement. You're going to take one leg at the knee and dropping it out to the side. Again, you may find that initially you can only move a couple of inches and then back in. All the time keeping your pelvis level, and it's keeping that pelvis level that is switching on those core muscles. Doing it on one side and then the other. That's lovely. And again, as before, depending on how you feel, you'll choose how low you take that leg and how many repetitions you do. You're looking for a sense of increased flexibility, mobility as you're doing them. Then finally, we're going to move into your glutes muscles. So they're your bottom muscles. They often tighten up when your lower back is feeling stiff and sore. What you're going to do is just gently take one leg, placing the foot or ankle across the other. Feel free to help it using your hand if you need to, and then gently using your hand, ease the knee away from you, listening to your body, using your breath. So as you breathe out, just apply a little bit of pressure down through that knee. Taking a few deep breaths in that position before swapping to the other side. That's great. Using the breath, nice big deep breaths. Lovely, and then returning to your starting position. Now you've spent a few minutes in this position, maybe 5 or 10 minutes. So now what I'd like you to do is to roll onto your side in order to get up off the floor. So just very gently moving over and onto your side, just letting yourself settle for a few moments. You may find that you want to push up into sitting, or you might find that you need to go into all fours. You want to do this repeatedly during the course of the day, as often as you can, until it starts to feel freer.